Welcome to the Dismantling You podcast. I'm Lisa Pineda, and today we have an amazing guest, Dr. Michelle Goldsammler. Welcome, Dr. Goldsammler.
Thank you, Lisa, for having me. So excited to be here today.
My pleasure. First, I want to give our audience a little bit of your background. Dr. Goldsammler is a board-certified reproductive endocrinologist and infertility specialist, an obstetrician and gynecologist. She has clinical expertise in both reproductive endocrinology as well as all aspects of fertility treatment such as IUI, IVF, as well as preventative and medically indicated fertility preservation. She cares for patients at both the Melville and Lake Success locations of RMA of New York, Long Island. Prior to joining the practice in 2023, Dr. Goldsammler worked closely with minority populations of Bronx and Westchester County to achieve their reproductive goals and served as the REI residency site director at Montefiore Medical Center, where she trained the next generation of OBGYN physician and fertility specialists. She continues to educate her patients to empower them to be active participants on their reproductive journey. Practicing an individualized treatment approach, Dr. Goldsammler takes patient experience as a priority in the delivery of culturally sensitive patient care. We are so lucky to have you today, Dr. Goldsammler. You are the only female Orthodox Jewish REI on Long Island. What a treat and what a gem. I want to get more into that. But before I do, talk us through your journey.
Sure. So I am a New Yorker. I was born in New York. I'm born on Long Island, raised on Long Island. And now I'm back on Long Island again. So born and bred New Yorker. I always had a sense that I wanted to do something like medicine. And I grew up in a medicine household. My father's a physician. And sometimes you hear these stories about family physicians and it's kind of the expected in the next generation. But my father actually encouraged me not to go into medicine. This was something that I really, truly loved. I think coming with that understanding of how difficult it is to go through all the training and the process. And then the difficulty with sharing some of those excitements and some of those losses with patients. It's tough. It's tough emotionally for a lot of people. And so my father's the kind of person who said, unless you love it and this is your dream and what you're driven to do, it's not something that I would encourage you to do just because. And so despite all of that, I still found myself drawn to medicine. I still found myself loving it. And so I still ended up in medical school. And in medical school is really where I kind of got a sense of what I wanted to do, how much I loved REI and fertility. And I think part of that is really because I love puzzles. I love figuring out how things connect with each other. And so I love seeing how one thing affects something else and seeing those downstream effects. And I saw that in a couple of different fields, but it really kind of drove that peak of my interest when I had my second year reproductive course. And we learned about hormonal patterns, and we learned about how one signal can cause an effect somewhere distant from it, far away in the body. And I really kind of just fell in love with the whole idea, the whole concept. And from that second year of medical school, I knew I wanted to do REI. I knew I wanted this to be my life, my approach, my dream goal. And so I kind of pursued that straightforward. And so I went to OBGYN training for the purpose of being an REI. Never looked back.
That's amazing. And it takes a special person to be an REI. It can be overwhelming and even daunting. What do you enjoy about your role as an REI?
So I love that REI is a field where people, couples, patients are really driven and motivated for their own health and kind of to embark on this fertility journey. I really like that special relationship with patients where I am there to help and encourage and experience with them, again, those highest of highs, those joyous of occasions, and often the lowest of the lows when things don't work out the way that they should. And I'm honored that I'm able to kind of be there with my patients and know that I'm there rooting for them, encouraging them every step along the way. So I really love that connection That's what I love the most.
That's amazing. And now, as a practicing Orthodox, you are so unique to have something that other doctors don't have in terms of this knowledge and background. I would love to hear from you what considerations are specific to the people in the Orthodox community.
So there's definitely some religious considerations that go into fertility treatment. But even before that, I think just the concept of being a religious-minded person gives me a little bit of a different perspective on medicine. And so understanding that or believing that there is a higher order, that there are things in the universe that we don't fully understand or may not understand yet, I think provides for me a sense of humility that I don't know everything. Or I may not know everything now. I just know where I am at this point in time in my life. And I think coming to the doctor-patient relationship with that humility and understanding that what I know may not be everything that's right for this patient. I think that that provides a really unique perspective that, you may not have from some other way. From the Orthodox religious perspective, obviously having that cultural sensitivity and especially knowing when to ask the right questions, I think is really important. There are some people that don't feel comfortable telling their doctor when medicine and religion may feel like they conflict with each other, or when they're not trying to go against what the doctor's recommending, but they're finding it difficult to kind of complete that and kind of coordinate that into what their religious lifestyle looks like. And so for me as a religious person, understanding where those difficulties are in the workup or in treatment, understanding Jewish family law, Jewish family purity, things like the mikvah, the ritual bath, and the timing of all of those specialized interactions with fertility and reproduction and intimacy between couples, I think that really kind of gives me a nice edge to help this population in general.
And it's great to hear that patients are speaking up about this and whatever faith they are, whether they are Jewish or Catholic. You don't have to lose your values in the process, and you should share with your doctor everything and be an advocate for yourself. Was there something in your medical education that spoke about religion?
It's an interesting question because medicine and medical education is very academic. It's very secular. There's not necessarily that religious element to it. But where I went to medical school had an environment that believed in social justice and believed in diversity and difference within culture and kind of really was sensitive to those cultural differences among different populations. And so from that perspective, it created a really nice, warm, welcoming environment. First of all, for myself to feel free to have that freedom of expression of religion within that environment, but also to kind of pursue some of my interests of the crossover between religion and education. And so I actually was able to pursue a master's degree in in medical ethics, and was able to take some courses in Jewish medical ethics. My thesis actually was involved with Jewish medical ethics and the ethics of gender selection and things like that. And so while medical school doesn't have a strict curriculum, diverse population and that environment that encourage all different cultures to flourish, I think really helped.
What about any sort of physician training, and what are they doing to the other doctors if they don't have this sort of knowledge?
So there's not specific religious sensitivity training. I think that part of that is more seen when you serve a certain population, you kind of get a little bit of on-the-job training about that. But definitely medical school, and many medical schools have an ethics curriculum, have a cultural sensitivity curriculum that at least opens your eyes to the possibility that not everyone is like you. Not everyone has the same values that you have. And that just because they have different of opinion or different values doesn't mean that it's wrong or that they're being combative or disruptive. And I think every medical school has those cultural competencies that every physician should have.
So eye-opening. Is the Orthodox community becoming more open to these topics?
I think that there's definitely been a progression and a movement over the past, I would say 5 to 10 years, really to kind of normalize fertility, normalize seeking medical care, getting fertility treatment. I definitely think there are some communities that could use a little bit more of a push, definitely could use a little bit more education, a little bit more encouragement. But there's definitely been a lot of growth than what it was previously.
That's great to hear. Now, let's talk about infertility. To the extent that we have limited airtime, can you explain what is unexplained infertility?
Unexplained infertility is one of those really tough diagnoses. It's actually one of the most frustrating diagnoses that a patient or a couple can get. Unexplained infertility means that everything on paper looks okay. The egg number looks okay, the uterus, the fallopian tubes look okay, the sperm looks okay. And so from that initial look that we have with our initial testing, everything looks like it should be fine. And yet still the couple struggles to conceive, or still that person struggles to conceive. And so I like to reassure patients that unexplained infertility doesn't mean that we don't know what the reason they're having difficulty is. It's that we don't know yet. There are a lot of pieces of the fertility picture, the reproductive picture, that we can't tell from a blood test and an ultrasound. When you get pregnant naturally, or you get pregnant with an intrauterine insemination, there are parts of that process that we can't see. We can't see fertilization. We can't see how egg and sperm combine. We can't see how those embryos develop, or if they develop properly. We can't see what the genetics of those embryos are. And so some subset of couples have issues with some of those pieces that we can't get with regular kind of testing. If we were to do certain treatment like IVF in vitro fertilization, sometimes with that, it's therapeutic. It helps them get pregnant, but it also provides a lot more information than what we had previously. We can actually see fertilization. We can see how embryos grow and develop, see if there's an idea that maybe there is an embryo quality issue, maybe an egg quality issue, a sperm quality issue. Yes, the numbers look okay, but how they're interacting and developing is not what we would expect for them. And so all of those pieces of the picture, sometimes we can get a little more information as treatment progresses. So while unexplained infertility is a frustrating diagnosis, it doesn't mean that we won't ever have the answer. It means that we may need a little more information.
Good. What is the correlation between exercise and infertility? Does it help or harm?
So I think exercise is one of those things where I like to say everything in moderation. Exercise, healthy lifestyle is good to put the person who's trying to conceive in a good, healthy place in order to get pregnant. I think it helps with keeping yourself weight neutral. It helps with glucose management, things like that. I think exercise is really helpful, especially for that subset of population that has ovulation issues like polycystic ovarian syndrome, PCOS. Exercise can help them with their insulin resistance, can help with weight loss, which also helps improve their regularity of their cycles. And so exercise definitely has a role in fertility. I think over-exercise or exercise to the extreme has a detriment. And we see that with our athletes or our extreme exercisers, where they start to actually get irregularity in their cycle. And that's their body and their brain telling them that they are in such a nutrition deficit state because of that extreme exercise, that their body's not ready for pregnancy. And so the system actually kind of shuts down temporarily. And so I think exercise has its role. It's a good thing, but in moderation.
Does B12 deficiency play a part in infertility? Is this true?
So B12 is interesting. It definitely is an area of research a lot of people are looking at. There's some data, some research about its effect a little bit on sperm, actually, sperm motility, sperm morphology, a little bit less clear in terms of the data about effect on women and female fertility. Definitely, if you've had B12 deficiency, you should definitely replete and kind of get supplements for that, especially in the population that have had gastric bypass. They tend to have deficiencies in vitamin B12 and need to get supplements and repletion. And so from that perspective, definitely make sure that you're at a normal level. But B12 is included in most prenatal vitamins. And so most women who are trying to conceive that are taking prenatal vitamins will have some extra in their stores.
Does some exercise help improve endometriosis?
So I think exercise helps with endometriosis in terms of pain control. So exercise releases endorphins. I think those endorphins do play a role in that pain cycle with endometriosis. And so I think there's a role there, especially mentally, to kind of get those patients with endometriosis to even feel better from that.
One question I got from a patient who was recovering from laparoscopy where endometrius was removed, she asked, I'm looking for ways to help it not grow back.
So endometriosis is tough. It's a tough diagnosis because it's a progressive disorder. And so if you don't take steps to kind of halt it or suppress it, it will continue to develop. And that's just because it's responding to your body's natural hormones every single month. Every single month you are growing the lining of your uterus. And so therefore all those little implants of lining tissue outside the uterus, that's what endometriosis is. All of those little implants also grow every month. And so unless you're on medication to suppress that growth, the disease, the disorder will progress. And so I recommend for anyone who has had surgery or has that diagnosis, when they're not actively trying to conceive, I would say they should be on some sort of hormonal suppression to try to prevent that progression of endometriosis.
Mm-hmm. What can women do to prepare during downtime while waiting for an embryo transfer and then just right after?
The waiting period is one of those tough, frustrating ones where people get into their own heads and start doubting their treatment. Did they do everything that they needed to do? All of that. I mean, I would say in general, healthy lifestyle. You're planning for pregnancy. You want to be the healthiest you can be before you get pregnant. And so if you need to optimize yourself medically, if you're diabetic, let's get control of those sugars. If you have high blood pressure, let's make sure you're on the right medication for a low salt diet or things like that. Mm-hmm. And so medically optimizing yourself before an embryo transfer is important. Mm-hmm. I would say the biggest piece of advice I can give you for that waiting game after the transfer itself is give yourself some grace. Okay? Implantation happens naturally when people are walking around doing all sorts of things. They are doing yoga. They are doing flips. They are walking in their regular daily environment. People don't know when they implant their pregnancies. They might know when they ovulate, but they don't know when they implant. And so a natural movement is okay. You don't have to stay in bed. You don't have to worry about, did I eat the right thing today? Did I have a cup of coffee? Is that caffeine going to affect implantation? I really want to encourage people to give themselves a minute, give themselves some grace that it's going to happen for them, regardless of if they remembered to take that extra prenatal vitamin or that extra folic acid that day.
Amen. That is sound advice right there. What is your take on blood thinners prior and during pregnancy, natural killer cells, and immunity protocols?
So I think all of these areas, all these topics, I think come up a lot for women who have difficulty either with pregnancy loss, recurrent pregnancy loss, or with recurrent implantation issues. So that's where all of these elements kind of play a significant role. I think that blood thinners do have a particular place for a subset of people. Mm-hmm. And so when I have patients who have recurrent pregnancy loss or recurrent implantation issues, I do a set of diagnostic testing to see if they would qualify for things like aspirin, things like blood thinners. And so at times I find thrombophilias or blood clotting disorders that were undiagnosed in this population, or other factors that may implicate blood clotting issues at that initial implantation. And so in that subset of people, I think blood thinners are excellent. They really help with that implantation. They help with maintenance of that initial pregnancy. For others, just taking a blood thinner in general, if the issue is not related to those blood clotting issues, then there's an element of caution there before just taking blood thinners empirically. Blood thinners can cause bleeding. They're not without potential harm. And so I think that you need to have a good reason to have them. Natural killer cells, immune protocols, those are all really focusing on the environment of the uterus and implantation. Definitely it's a big area of research right now. I think there's a lot we know about implantation, but there's a lot we don't know about implantation. And it makes sense that a foreign tissue, the embryo, is implanting in the body, and therefore there is an immune response that needs to happen, immune tolerance that needs to happen to let that foreign material be incorporated into the body. And so there definitely is a very strong connection between immunity and implantation. But I think that we're still in that area of research about what can help improve that immune milieu for the uterus. And so I think natural killer cells, I think immune protocols are kind of still in that research phase. And so I'm really interested in kind of seeing where that research turns up and kind of hoping to see some good evidence to kind of encourage us to use protocols that kind of help.
For people who have miscarriages, even with PGT normal, what do you recommend?
So that's always tough. PGT normal embryos is really just telling you the genetics of this embryo. Now that's good information to have. That's important information to have. We know that that's not the end all and be all for implantation in general and miscarriage. And so again, like I have for my recurrent pregnancy loss patients, we look for those other things. We look for thrombophilias. We look for hormonal issues that may increase your risk of miscarriage, like thyroid disorder or diabetes or other hormonal imbalances that may cause issues with miscarriage. When I have patients that continue to miscarry with PGTA normal embryos, I also take a look at the person who's trying to conceive. Have we medically optimized that person? Do we need to work on BMI? Do we need to work on their medications? Do they have any chronic medical issues that we need to address? And so I kind of take the opportunity to take a step back and make sure that we're not missing something for that subset of population.
So switching gears, I like to ask all my guests some rapid fire questions. Sure. And I'd love for you to rate these fertility topics from 1 to 10, starting with ovulation tracking devices.
Give that one a 7.
Botox for pelvic pain.
If it's for like vulvodynia, I would say probably about a 5-6.
Castor oil packs and pelvic non-invasive manipulation for pelvic pain.
Give that one a 3.
Supplements for egg quality thyroid issues.
Thyroid issues is a little bit higher than some of those other supplements. Thyroid issues, I would give probably around an 8. Egg quality issues, I would probably give those supplements around a 6.
Any specific supplements that you would recommend?
It's really tough to say. I think that there's a lot of diverse data about supplements. And so there are certain things I will talk to my patients about, but I also individualize that conversation. And so I don't give everybody the same supplements. I don't tell everybody to take supplements. Not everybody needs them. And so that's really more of an individualized approach.
Last one, acupuncture and cupping massages.
I'm sure I give an 8. I love it. I think it helps de-stress. I think it helps lower cortisol levels. I think there's good data about it.
So the last question I always like to ask all my guests is what they like to do for self-care and what you do to de-stress.
Good question. My professional life is very busy. My home life is very busy. I have 4 kids at home, all a result of fertility treatment. And so home life is stressful as well, but we have a good time. So when I do have the opportunity, I'm an avid reader. I love reading. I find being able to take myself out of reality and kind of into fantasy a little bit is a nice kind of way for me to de-stress and just relax.
Love that. It's important for you to take time for you because as an REI, it can be overwhelming. Tell our viewers where they can find you online and your preferred social media.
Sure. So you can definitely find me through RMA Long Island, RMA of New York of Long Island. I'm at the Melville office. I'm at the Lake Success office. You can definitely look me up on the website. There's an Instagram, RMA Long Island IVF, Facebook as well. I'm happy to see you all, happy to have a conversation, a consultation, happy to help you any way I can.
Well, thank you so much for joining me today in person, Dr. Goldsammler. You're an amazing doctor and you are so unique in your services.
Thank you. Thank you so much, Lisa. So happy to be here with you. Thank you so much for having me.